Hello everyone, in this video we are going to discuss about sarcoidosis. Sarcoidosis is a multisystemic granulomatous disease of unknown etiology commonly affecting the lungs, skin and eyes. So the pathology is, it is a non-caseating granulomatous disease versus tuberculosis, it is a caseating granulomatosis. So we can differentiate these two by the caseating and non-caseating. Non-caseating granulomas are seen in sarcoidosis. In this picture we can see it is a non-caseating granuloma which is seen in the sarcoidosis. This is a caseating granuloma seen in tuberculosis. So granulomas containing the epithelioid histiocytes, it is modified macrophages, giant cells and Schwann bodies and asteroid bodies. These two are seen in sarcoidosis. Schwann bodies are nothing but these are concentric laminated calcified bodies, mostly basophilic in structure, and asteroid bodies are eosinophilic and seen within the giant cells. Schwann bodies are also seen in some conditions like berylliosis, but asteroid bodies are more specific to the sarcoidosis. Next, the commonly affected organs are the lungs, where we can see bilateral hilar lymphadenopathy, as we can see in this picture on the X-ray. Skin, we can see erythema nodosum, uveitis in the eye, and it mimics the Sjogren syndrome because it involves both salivary and the lacrimal glands. And in heart, we can see conduction defects, and nervous system, facial nerve palsy. So other symptoms are cough, dyspnea, skin rash like erythema nodosum, uveitis, Bell's palsy because seventh nerve palsy is seen. So it is a Bell's palsy, and fatigue, fever and weight loss. So the main signs, and we can see on the X-ray, are bilateral hilar lymphadenopathy, as we can see on the X-ray. And the name signs we have to know is lambda sign and the panda sign. These two are seen on the gallium uptake scan. Panda sign is nothing but gallium uptake in the lacrimal, parotid and the salivary gland, showing this panda appearance. And lambda sign is bilateral hilar lymphadenopathy plus pretracheal lymphadenopathy. And if it is seen on the X-ray, it is called as 1-2-3 sign. This is pretracheal, these two are bilateral hilar lymphadenopathy, also called as Garland sign or 1-2-3 sign. So associations are Laughlin syndrome and Heathford syndrome. Laughlin syndrome is nothing but erythema nodosum plus hilar lymphadenopathy and arthritis. Heathford syndrome is uveitis, parotid enlargement, fever and facial palsy. So first line treatment is corticosteroids we will give when symptomatic or any organ involvement is seen. In case of when the patient is not able to use the steroids or steroids are not working, you can use steroid sparing agents like methotrexate, azathioprine, hydroxychloroquine, and in refractory cases TNF alpha inhibitors like infliximab. And many cases, if they are asymptomatic, may resolve spontaneously. So we can remember this sarcoidosis by the mnemonic of sarcoid. S stands for Schwann bodies, A stands for increased ACE levels, R stands for respiratory symptoms, C stands for increase in the calcium, O stands for ocular involvement, I stands for immune response, it is CD4 plus cells, D stands for dermatological involvement like erythema nodosum. So we have to see some key lab findings where increase in ACE levels, hypercalcemia is seen because the macrophages will secrete 1-alpha hydroxylase, which converts this 25 hydroxy vitamin D to 125 hydroxy vitamin D. So this increases the calcium, intestinal calcium absorption. So hypercalcemia and hypercalciuria is seen. This is PTH independent. So since there is hypercalcemia and hypercalciuria, that is increase in the hypercalcemia is increase in the serum calcium, hypercalciuria is increase in the calcium in the serum, in the urine. Calciuria is increase in the calcium in the urine. So there is increase in the calcium, so PTH will be decreased. So we can see this, we can monitor these levels, and we can also see elevated CD4 to CD8 ratio in the bronchoalveolar lavage. It is significant, and we can see non-caseating granulomas on the biopsy. So this is sarcoidosis, Schwann bodies, raised AC levels, respiratory system symptoms, increased calcium levels, uveitis, immune response, and erythema nodosum.